So move now from small intestine into large intestine. My magnification always seems to be going. Okay. So we're going to be moving now from small intestine into large intestine. Okay? And we're going to see the preponderance of goblet cells. Okay, lots of goblet cells. Okay? And then now we see, what is known as ileocecal junction? Yeah, let me see ileocecal. Sorry. Yeah. No, Mr. Solomon will tell you. And we also know this ileocecal junction looks just like a what? A seagull. Okay? Just like with the wings. See their mane? Very good. So just like a seagull flying off. Alright? Alright, so we're moving here now from, just as we did with pyloroduodenal junction, we're now moving from ileum to colon. So this is the famous ileocecal junction slide right here. And very interesting, as you look at that slide, what's interesting is what? The lymphatics. They're right there at this junction that we are seeing here some prominent lymphatics right here. Okay? So this is still all here colon. That's still colon. Let's go back and see if we can find a bit of jejunum. Ileum, yeah. Alright. There. So there we are in the land of ileum. Okay? So there we are in the land of ileum. Now, we are fortunate that we are seeing right here the Pierce patch. Okay? Because remember, when we're going from ileum into colon, the Pierce patches are on the anti-mesenteric border. So it's not all around. So not all slides, all cuts of the ileocecal junction will be showing these Pierce patches. Okay? So this is a beautiful slide here showing the Pierce patch. Right at the ileocecal junction right here. Let us use a 5-1 or something. So there we see now the ileum right here. And there we see the goblet cells in the villi. That's the Pierce patch coming right here. And we go back now to a lower power right here. And there we are now going. So there we see the presence of villi. And as we're moving along to here now, the villi now become absent. Okay? So there's what is known as the ileocecal valve. And this may be just in the region of the ileocecal valve. And once again, lo and behold, what do we see right in that region? Autonomic tissue. Alright? So we're seeing here, very interesting, very interesting, strange. Right there, we're seeing a bit of orovax plexus. So right at that junction there, look at that, right associated with the valve, okay, maybe controlling the movement through that valve, alright, the opening, so that is the ileocecal valve, just about in this region here, and note, just coincidentally, that this is quite a bit of autonomic tissue. Okay. There. Right here, yeah. Beautiful. Okay. So just right here now, there we can see, in fact I haven't come up this slide right here so far. So we were looking right here, so just as we go a little further up, now we see the smooth muscle going in that circular layer, and this is the beautiful valve. So when you dissect the cadaver and open up the cecum in the region there, you see very clearly the ileocecal valve. Alright, so this is a beautiful slide here. Thanks, this is your slide, Tom? Thanks a lot. It's a beautiful slide of the ileocecal valve. So this is right at in the region of the ileocecal junction. So there we see now ileum going right into colon right here. Okay? So this is a fantastic slide. And what do we notice? That in the submucosa is highly vascularized. So the submucosa highly vascularized right here. So lots of arteriovenous shunts occurring right in the submucosa of the gut. Alright? So lots of vessels, lots of blood vessels within the submucosa. Alright? And very close to that, look here, right here, there we're seeing a lot of autonomic. So these are postganglionic fibers right here, postganglionic cell bodies. Right associated with that junction is a lot of the postganglionic fibers. Okay? So vagal fibers, vagal preganglionic fibers are ending right here. And we see right at the region of the junction, lymphoid tissue and vessels right here. Okay? So blood vessels right here, one of the major arteries, maybe one of the cecal arteries. Okay? So this is a fantastic platinum slide. Okay. Now, let's now look at straight colon, and we're going to try to find now the tinae coli.